Welcome back. Well, one of the body's closest connections are the brain and the heart, and doctors are working to learn how best to keep both as healthy as possible. So joining us now is Dr. Paul Wechsler, a stroke physician for UC Health. And thank you so much for joining us.
Thanks so much for having me.
Yeah, so of course, we hear about strokes and heart attacks often, but now you're saying that they could be connected in some way. Tell us a little bit about that.
Yeah, so the heart and the brain really are connected very closely. And the key thing to know is that when the heart isn't healthy, sometimes the brain isn't healthy either. So for example, if the heart isn't pumping blood enough, blood clots can form in the heart and then go up into the brain and cause a stroke. And so it's really critical. If you keep your heart healthy, you can also keep your brain healthy as well.
And so what are some signs that people should be looking for? This signifies, okay, maybe I need to change some things. My heart's not as healthy as it should be.
Yeah, particularly for the heart, if you're having chest pain when you're walking around, if you're feeling short of breath. And then specifically for stroke, we have a word that we use in order to teach people signs and symptoms of stroke, which is FAST, which is face weakness, arm weakness, speech difficulties, and time to call 911 if you have any of those symptoms at all.
So before you get into those emergency situations, if you are kind of like walking around, you feel a little bit of chest pain, and if you realize that, maybe I should change some ways, are there diet things that you can do, some exercising you can do?
And there's a lot of great things you can do, and even small things can really make a big difference. For example, exercise is one thing. We typically recommend at least sort of 2 to 3 hours of exercise per week.
Okay.
And then diet is a really big thing as well, focusing on fruits, vegetables, and other healthy foods like that.
The things that we hear, you have to apply it, right?
Right, exactly. And it's harder, it's easier said than done. It's absolutely.
It really is. And so tell us about some of the treatments that you will have. Are you all seeing any breakthroughs in technology that's helping people?
Absolutely, absolutely. And so, at UC Health, we're really trying to figure out better ways to treat people with strokes and with heart disease as well. And so we have a lot of novel treatments that we're able to offer our patients. And so we're really excited about that. We're really trying to push the boundaries of how we can keep people as healthy as we can.
Yeah. So for those who want some more information on what to do, where can they go?
Yeah, so the best resource to me is the American Heart Association. If you sort of just Google it and go online, they have facts about stroke and heart disease and ways to keep yourself healthy, and really have a lot of great resources for people in the community.
And just one more question. As far as, if you do make some diet changes, you make some exercise changes, how quickly can you see some of those results? To make a big difference.
It could really be actually very quick. And particularly if you do these things over a long period of time, you really can reduce your risk of having a heart attack and stroke very significantly. So it's really critical to really do these things.
Get started today.
Yes, exactly.
It's never too soon to start. Well, thank you so much, Dr. Wechsler, for some insight on that. We'll send it back over to you, Sal.